Hi, I'm Dr. Karen Smith. We're talking about preparing for your foot surgery. It's really about getting organized and knowing what to expect. I can tell you from experience, after performing hundreds and hundreds of foot and ankle surgeries, there's really the patients who are psychologically prepared as well as physically prepared that tend to heal well, have fewer complications, and certainly have a much more pleasant overall experience.
Your surgeon may choose to have you schedule a separate preoperative visit to thoroughly review your surgical procedure and postoperative instructions with you. If you have a few questions, I recommend that you bring a list with you. It's always easier to fully listen when you're not trying to simultaneously remember what questions you have in mind. Once the medical assistant or your surgeon has discussed the consent form and postoperative instructions with you, you can review your list to ensure that all your questions have been answered. Bringing a friend or family member with you to your preoperative visit for a second set of ears can also be helpful. Sometimes it's more difficult to listen and retain information well when one is feeling anxious, which is perfectly normal for any patient at a preoperative visit. If you've had any changes to your medications or been diagnosed with any new medical conditions since your previous visit, be sure to update your surgeon with any new information. If you haven't received an evaluation by your primary care physician in over a year, you might be required to do so for a medical clearance prior to your surgery. You may be required to get a chest x-ray, an EKG, and certain lab tests prior to your surgery. Sometimes some or all these tests are performed in the hospital just prior to your surgery once you've checked in. If you're a woman of childbearing age, a pregnancy test will most likely be done the day of your surgery. You'll be reminded to stop taking anti-inflammatory medications prior to your surgery. Typically, you'll be instructed to stop taking them about 7 to 10 days prior to your surgery day. This includes aspirin, Advil, Aleve, Motrin, ibuprofen, and even fish oil supplements. These types of medications affect your blood's ability to clot and therefore results in excessive bleeding that can put you at higher risk for certain complications. One anti-inflammatory medication that's an exception to this rule is the prescription medication Celebrex. Your surgeon may or may not allow you to continue using Celebrex prior to your surgery. If you take the medication Coumadin, otherwise known as warfarin, or Plavix, your surgeon or the prescribing physician of the medication will instruct you as to how many days you'll need to stop taking your medication prior to the surgery and when to resume the medication. Even if you have the most talented surgeon and you're in the best of health, complications can occur. Unfortunately, the human body is never 100% predictable. Even though the risks of complications for healthy individuals who are having an elective surgery are very low, there are always risks of complications with any surgery. Keeping your body at optimal health before and after your surgery is one of the best ways to avoid complications during your recovery. For example, if you have diabetes and you keep good control of your blood glucose levels prior to your surgery and throughout your recovery, you'll increase your chance of healing at a normal pace and decrease your chances of infection. Get great nutrition, appropriate hydration, follow the postoperative instructions provided by your surgeon, and avoid tobacco products. We know from a multitude of studies that smoking interferes with healing. There are even certain surgical procedures that most surgeons won't perform on smokers simply because the failure rate is known to be so high in smokers that the risks outweigh the benefits. If you're a smoker contemplating surgery, please talk to your primary care physician about smoking cessation options that may be effective for you. If you really can't quit smoking, even cutting back by half can improve your body's healing potential. Make plans to be a complete couch potato for at least 3 days after your surgery, possibly longer. It's very important to take the time to rest and heal following surgery. Prepare your employer, your family, and especially yourself that you're not going to be available for other people's needs for a while. If you have young children, you'll need someone to help you care for your children. How much time you'll need to take off work really depends on the type of surgery you're having and the type of work that you do. Typically, you'll need to be prepared to take at least a week off, but again, that's going to vary. You really want to minimize the swelling and let your body rest for those critical 3 to 5 days after surgery. If you have a desk job, you can sit and elevate your foot at work, and you're healing well, your surgeon may allow you to return to work after only a few days. But it's better to be prepared to take more time off and return to work earlier than planned than the other way around. If you're the person in the household who typically does the cooking and grocery shopping, let your family know that they're going to be getting takeout for a few days. If you live by yourself, go ahead and pre-cook some meals that you can reheat later and get yourself some low-maintenance snacks. Standing excessively during the first few days after surgery will increase the amount of swelling in your foot, which will increase the amount of pain. You're not going to be allowed to drive during part or all of your recovery period, and if you're having surgery on your right foot, you may not be allowed to drive for several weeks or even several months, depending on the type of surgery. So be sure to plan carpooling arrangements ahead of time to avoid frustrations. Remember, you're going to be camped out on the couch for a few days, not out running errands, so make sure you have everything you need before your surgery day. And if your surgeon was kind enough to give you your prescriptions ahead of time, go ahead and get those filled before your surgery day as well. If you're having an outpatient surgery, in other words, you're not staying in the hospital overnight, you'll need to arrange for someone to drive you home and stay with you for at least 24 hours. Hospitals and surgery centers typically don't allow taxis to drive patients home after surgery. If you have hairy feet or a lot of hair near your surgery site, leave it alone. Removing hair creates microscopic nicks on the skin surface, which allow bacteria to colonize in the area. Studies show that the best time to remove hair near a surgery site is immediately prior to the surgery. The good news is that someone else will take care of it for you. You don't need to worry about it. Some of my patients ask about nail polish, and as long as it's not chipping or peeling, it's fine with me. But that's my policy. Your surgeon or the hospital where you're having your surgery may not allow it. Oftentimes, the hospital or surgery center where you're scheduled to have your surgery will contact you a few days prior to your surgery to review a list of guidelines and policies with you. Remember, we've reviewed the basic general guidelines for foot and ankle surgery. Only your surgeon knows the specific surgery that you're having and is familiar with your medical history. So be sure to follow your surgeon's instructions and discuss any questions you may have with him or her. They'll be happy to answer them for you. Thank you for watching My Lady Foot Doctor, and please join me for part 2 of preparing for your foot surgery. I'll be discussing anesthesia, your surgery day, and your successful recovery. Thanks for listening.